These are complex times. We know that we've all had a hard time, both professionally and with our own mental health. And if we've injured ourselves, we are having problems there. And shoulder injuries, as you probably know, are quite often seen. We were chatting before this meeting, and it turns out that I'm a study in shoulder problems. So you'll see me crying and empathising with everything that goes on tonight. We're seeing now more and more DIY people, DIY enthusiasts falling off of ladders, bashing shoulders, people who will get to the gym next week, we'll talk about that, and not going to hospitals because they were terrified of going to hospitals. And we might also be seeing unmanaged neural problems from some of these traumas as well. So neurological issues from bashing arms. And there's a lot of the treatments about there that have got really good evidence, and some that don't have such good evidence, and some you have to take the pragmatic approach. So we're going to address some of those now. So, Mr. Dattani, Rupen, what sort of things are you seeing now in your return to practice? Are you seeing more acute, more subacute, or some mismanaged chronics?
So Dave, yes, it's probably a combination all of the above. So we've got a group of patients who've had sort of shoulder pain for several months, maybe started at the beginning of the year. We're trying sort of non-operative treatment, anti-inflammatories, physiotherapy, and then lockdown happened, and they had sort of almost no access in terms of healthcare at that point, or they just felt too frightened to get their shoulder looked at. And so those people are now, we've sort of got chronic sort of shoulder pain now. We're seeing quite a lot of those. The other thing is obviously injuries, as people are becoming more active. It's interesting, we talked about gyms opening next week, but, I've had quite a few injuries where people have got a makeshift gym at home and, probably not taking all the right precautions, and as a result have injured their shoulders doing that because they've, got a makeshift gym either in their garage or in the backyard.